When niche clinicians work together, the lessons, the outcomes, and the processes take on a different meaning. Multidisciplinary care is so important. How do you view the pink-white interface? The Perioprosto series comes to Tubule, featuring Dr. Boota Ubhi, a specialist periodontist, experienced implant surgeon, and clinical director of BPI, and Dr. Gurvinder Bhirth, a man with a passion and talent for restorative dentistry. Both are guided by strong principles and ethos of excellence for the long term.
This really series of lectures, we're talking about perio and pros as a consideration. There's a lot of joint planning that goes in. What should we say is the thing that general practitioners can really take out of it?
Being in one place, seeing your patients, decade after decade, we want longevity. We want to have the patients to have the set of treatment, and that's it. We don't want to have continual repeat treatment or failures. Well, I would emphasize why the hygiene aspect of all of this is so important. The maintenance is so important. We know with good maintenance, right, good hygiene support, we can keep all the restorative, the implants and everything else, right, at a really, really stable level for years to come. It's always got to be about the patient.
Good planning, good sort of execution, and trying to work out good predictability. Not the easiest thing to do, and some of the things you share are about that.
It is. I think with every GDP out there, we see patients all the time. Sometimes we're just looking at our own skill sets. We can do an awful lot, and we kind of, as a research centre, we're kind of right at the epicenter of this. We kind of plan, we decide a lot of things, and sometimes what we just got to do is look at the bigger picture. Is there other things that we can make both for the patient kind of an easier journey in terms of longevity, but also in terms of aesthetics? And do they need something else? Do they need the input from another clinician? The more you do this, the more you learn.
Both are guided by a high standard, constant learning, and documentation.
Having seen these talks, really, is the damn documentation that you've done.
One, you learn so much about your own work. And in terms of your own failings, if you kind of do a preparation, you think it's great. You take a photograph of it, you think, actually, I can improve that. So you can actually see your own work and critique that, and that's the best way of learning.
It almost becomes like a self-peer review.
Yes.
Right? And you go back and see a case from 1998, 1999 or 2000, and etc., how things changed. It's a bit of a discipline.
It is.
It's certainly a discipline that you've got to get the camera out before, during and afterwards, and then keep documenting afterwards. And I would say that to all GDPs really, photography is the one thing that's, it's going to help you so much.
With these principles, we bring you the Perioprosthodontic Connection, the ultimate series on dentinal tubules. Don't miss it.